legislation that you are putting in to strengthen the Hospital Conversion Act. First, just want to thank you for coming on.
Glad to be here. Thanks for asking.
Tell viewers just about the nuts and bolts of this legislation. Obviously, so much going on in the healthcare world right now.
Categorically.
So there's a lot that you're looking to do to strengthen this, especially in the realm of Care New England, looking at potentially partnering up with partners.
Right. So many things are happening in the hospital industry in Rhode Island. You have Care New England with partners. You have Lifespan with partners. You have Brown University. You have Charter Care with Pawtucket Memorial. It runs, and you have Yale University with South County in Kent. So it runs the gambit. I think we're at a critical juncture right now with regards to our hospital system in the state of Rhode Island. First and foremost, I'm concerned about the patient quality. Not that there's not quality patient care in Rhode Island, but I'm concerned about continuing that.
Yes.
First and foremost, about the patients. Secondarily, though, it's about the fiscal viability of the hospital system in Rhode Island. It's a $7 billion industry in Rhode Island, about 20,000 workers in the state of Rhode Island in the hospital industry. It's important we get this right. My concern with regards to putting in the legislation both in statute and a commission, the joint commission, Brett Marshall has it on the House side, is to allow us to look at this in a comprehensive, holistic manner to ensure we're covering all the facets.
I mean, there's probably no more opportune time to do this right now.
Absolutely. And the impetus for, obviously what was happening in the backdrop, but then when Lifespan said we want to join the conversation, I said, time out. We need to do something.
So do you think this really enables, especially the public, as it's vetted up here at the State House with this legislation, just to know the financial impact, the job impact? Do you think this will really go through with that fine-tooth comb to give people the information and stakeholders the information that they need before any big move is made?
Yes, and I'll say categorically yes. I think it's going to have some challenges because some folks are going to be concerned with regards to it's going to potentially slow down what needs to happen or what they want to happen or don't want to have happen. But I look at it from the perspective of it's about getting this right, and the time to do it is now.
So do you say it as well? I mean, as we're looking at the pension collapse of St. Joseph's Pension Fund, that was a previous piece of a Hospital Conversion Act. Do you think that's a little bit of an impetus to say, this next time we go through this process, we really need to get it right?
So I think I'm always very direct. As an engineer looking at the facts and data, I really haven't thought about that piece from that perspective. It probably will be a factor, but it's really going back and centered on the patient care, quality care in Rhode Island, and being concerned about potentially the high-end services migrating to the state next door to us, which isn't very far away, which will severely impact the healthcare industry in the state of Rhode Island.
Do we think, I mean, we know that Partners is in conversations with Care New England. They're in that sort of special agreement. We have been hearing from Brown that they have concerns about where they're at. Will they be part of the conversation?
Everybody will be part of the conversation. I believe Yale needs to be a part of the conversation. The folks in California will be a part of the conversation with Prospect Charter Care. We need to have everybody at the table and looking at what you'll see, two pieces being introduced. Both the commission's already been introduced, it hasn't shown up online yet.
Okay.
And the piece of legislation will be introduced once we can verify the language is in there. But it brings us a holistic group together, including the critical piece, Hospital Association of Rhode Island, the Medical Association, you name it, all those folks have to be at the table.
And you're introducing the legislation. Have you talked to colleagues? Do you expect this to go through and move forward with the process with getting all these facts that we need?
So I'm always a positive, optimistic person. I think, yes, my job is to make the case. The case needs to be made by all those involved about why this is important, and if there are concerns, how do we ameliorate and mitigate those risks and concerns to ensure we get this right, and the time to act is now, especially with what's happening.
And people ask about that, again, that big picture look at healthcare. Is this really filling that role, filling that sort of void right now to be the place where, again, all these questions are going to be asked and the data is going to be asked for?
So I think it's an initial step.
Okay.
The piece that's missing, what I hope the commission will look at, and I've had a resolution I put forward last year, is we need a statewide healthcare hospital plan. We don't have one.
No.
I believe the last one we have one, I have it in my other car, in the back of my car, and I got it from somebody. It was typed. It wasn't even on a computer. It was back in the late 80s, early 90s back then. We need a statewide hospital plan that says, here's where we are. So it's a case of what's the current state, what's the future state, and then what's the path to get there.
Does this legislation lead to a hospital plan?
I think it will. I think it's going to be the catalyst for when the group meets. Yes, when the group meets to say it's a joint resolution, a joint commission. They're going to come to the respect for a realization that we need a statewide hospital plan. It's critical moving forward.
Well, I appreciate getting you today when the announcement was made that this legislation was being put forth, but it's one of many things on your agenda. I've got you here right now. So talk with viewers a little bit about what's on your plate and what should we look for from you moving forward.
So I say at a macro level, my biggest concern is the budget. My biggest concern is the balancing the budget on the backs of the most vulnerable in the state. We had a hearing on Tuesday night with regards to Medicaid, Article 13, Article 14, and we're looking to cut $160 million, $160 million out of the budget, about $80 million general revenues, all from Medicaid. And we look at who's Medicaid. They are the most vulnerable in the state. I don't want to say the poorest in the state, but they are some of the poorest in the state. And I brought it up and I said, I can't support something that looks at, we need to be efficient and effective with Medicaid. So the budget is a critical piece to us. We have to invest in Medicaid and healthcare like we do other areas, not to the detriment, investing in other areas to the detriment of this.
So with these proposed Medicaid cuts, what's the alternative? How can we find, again, we're facing the $60 million budget shortfall this year. I'm looking at close to $200 million for FY19. If these Medicaid cuts are part of the budget, where else can we find that money then if this critical component needs to be there?
So I think I have a piece. We're all familiar, and I'm getting some flack for it, but the Jobs Development Act. The Jobs Development Act over years has paid out upwards of $20 million. Last year, Jobs Development Act paid out about $7 to $8 million to the two companies this year that are with a federal tax plan are getting over a $1 billion windfall over the next 10 years. These same two companies are providing jobs. We don't want to detract from that, but the same two companies, there's more than just two, but two predominantly get the vast majority of the money, also have a fair number of folks on rideshare and ride-care. And I have with me the analysis that shows over the last 6 or 7 years how much they've accumulated. And we're glad that they're here, how much they've received from the perspective of ride-share and ride-care. So that's a piece that's about $8 million. That's general revenues. The general revenue side of the Medicaid is about $80 million. I think I have 10%.
10%, it's a start.
Absolutely.
So you said it's a little controversial, but you know there have to be ideas and alternatives.
Absolutely.
And you've got that 10%. I can't ask you for the other 90, but do you have? I mean, what are the conversations like?
We're looking at others, and we have to look at. We can't just look at the budget in the context of just the Medicaid taking the 160. Let's talk just general revenues because that's the issue for the state in our structural deficit. And when we do address that in that area, that will affect positively a structural deficit in the future. But we have to look at some other areas where we might be able to get some savings, might be able to do things a little differently, maybe put some things off a little bit. But we have to look at that in totality. Do I have all the answers? Absolutely not. But I say we have 113 like-minded folks here at the State House looking at trying to move this football down the field and get it over the goal line so we're not taking it all out and realize, and I applaud the governor for not cutting rate eligibility or rates, but we got to look at this in a more holistic fashion because we've not, in the case of BHDDH, the Behavioral Healthcare Development Disabilities in Hospitals, or the Department of Children, Youth, and Families, and I've recently written an op-ed on this, people have said, well, they've overspent. No, we've underfunded them, and I'll say it again publicly. We have underfunded those two agencies while they're looking to transform and transition their work. From a business perspective, whenever you're looking to transform and transition, you invest more. Over time, it will be less, but you have to invest to transition.
And we've seen the ramifications of trying to cut the costs for DCYF. We do know that they were trying to reduce staffing, again, to meet those costs. So especially important to fund that to the level it needs to be funded at.
Correct. And I give the governor and I give Director Picola, and we talk on a very regular basis, Director and I. She's staffed up the casework workers. She's doing all the right things. She's getting out. I was with her out in the community on Monday in Newport. All the right things are happening, but it takes time. It just takes time, and it takes an investment to get there. It's not going to happen overnight. And if we continue to say they're overspending, bad behaviors will come from that.
Well, I appreciate your taking the time to come here in the State House to let us know again about this Hospital Conversion Act strengthening legislation, addressing the importance of Medicaid and your thoughts on how to fix that moving forward. And I'm sure we'll have you on here at some point in the future. So, Senator DiPalma, I appreciate your time.
Thank you.
I'll let you go, and we'll welcome our next guest. Don't go anywhere.
Have a good day. Thanks.
15? Yep.
Thank you.